prior to walking into the patient's room, I would wash my hands and close the door or draw the curtain to make sure that the patient's privacy would be ensured. So the first thing I would do when I walked in would be to introduce myself. So hi, my name is Carolina. I'm a student nurse practitioner at William Patterson University, and I'm going to be doing an assessment to you on some various systems. Is that okay?
Yes.
Can you start off by telling me your name?
Nicole Brzezinski.
And what's your date of birth?
2798.
Perfect. So general appearance of the patient, she is sitting upright. She's in no apparent distress. Her answers are clear and concise. She answers all of my commands, and she maintains eye contact throughout the exam. She is alert and oriented. Her skin color is consistent with her background. Her skin tone is even, which are all normal findings. So the first thing I'm going to be assessing is her head and her face. So for the assessment of her head, I'm going to take a look at her general head. It's normal cephalic. There's no deformities, no masses, no lesions that can be visibly seen. So I will palpate your scalp. Let me know if you feel any tenderness.
No.
No. And then I would also separate the hair section by section to check for any lesions or any masses that can be seen. Her hair is evenly distributed. There's no hair loss, which are all normal findings. The next thing I'm going to do is I'm going to take a look at her face. So just looking at her face is symmetric and proportionate with the rest of her body. There's no visible deformities, no masses, no lesions that can be seen on her face. Her eyebrows are present. Her eyelashes are present, evenly distributed. Her nose is in the midline, which are all normal findings. I'm going to assess cranial nerves number 5 and 7. So can you smile, frown, puff out your cheeks, raise your eyebrows, and then let me know if you feel this equally on both sides.
Yes.
Is it soft or rough?
Soft.
Okay, so cranial nerves number 5 and 7 are intact. I'm also going to palpate her temporal muscles. So can you clench your jaw? And that's palpable. And then open and close your jaw. And that is your masseter, and that is palpable as well with no abnormal clicking, which are normal findings. Next, I'm going to move on to the eyes. So for the eyes, I'm going to start off just by looking at her eyes. So just looking at her eyes, they're both present. They are evenly spaced. There's no discharge, no redness, no abnormalities that can be seen. I'm going to palpate your lacrimal apparatus. Do you feel any tenderness?
No.
Good. Okay, the conjunctiva is pink, her sclera is white, which are all normal findings. I'm then going to assess cranial nerve number 3, which is her pupillary responses. So normally I would turn the lights down for this. So what I'm looking for is to make sure that her pupillary response is brisk and that her pupils are equal and round, which they are, and that they constrict when the light shines in them, which they both did. I also checked her consensual response, and what that means is when I shine the light in one eye, the eye on the other side, the pupil on the other side also constricts as well. And then with accommodation, we want her pupils to constrict with that as well, which they did. So her pupils are equal, round, and reactive to light and accommodation, so cranial nerve 3 is intact. Next, I'm going to do the corneal light reflex. So I would stand a few feet away from the patient and just shine my light into the eyes. And what I'm checking for is to make sure that I could see the reflection of the light equally in both pupils, which I can, which is a normal finding. Then I'm going to assess her visual acuity. So for the visual acuity, I have the Snellen. I'm going to stand a few feet away from the patient, and I'm going to have her cover one eye and then read the smallest line that you could see.
LTFPH.
Perfect. And then with the other eye as well?
LTFPH.
Okay, great. So that is 20/20 in both eyes. To assess her near visual acuity, I'm going to have you just look at that and read the lowest line that you can for me.
LTFPH.
20/20. Perfect. So her visual acuity is intact, which is a normal finding. I'm then going to assess her peripheral vision. So let me know when you can see my fingers.
I can see him. See him. See him. See him.
Okay, perfect. So her peripheral vision is intact. Next, I'm going to do the cover-uncover test. So for the cover-uncover test, I'm going to have you look at me, cover one eye, uncover it, and then do the same thing with the other one. Perfect. That tests for nystagmus, and there is none present. The eyes don't try to correct themselves, which is a normal finding. Next, I'm going to test your extraocular muscle function, so cranial nerves 3, 4, and 6, okay? So can you just follow my pen line? And I'm going to check your convergence. Okay, perfect. So all of that was normal findings. Cranial nerves 3, 4, and 6 are intact. The next thing that I'm going to do is I'm going to take a look into her eyes with my ophthalmoscope. I'll start off on this side. So I'm going to have you just look straight ahead. Okay, the red reflex is intact. The optic disc is sharp and there's no abnormalities. And then I'm going to do the same on this side. Okay. The red reflex is intact. Her retina is intact. Optic disc is sharp and there is no abnormalities, which are all normal findings. Next, moving on, I am going to inspect her ears. So for the inspection of her ears, what I'm going to do is I'm going to first take a look at them. I'm going to inspect them. So they are proportionate with the rest of the body. They are both present. There's no masses, no lesions, nothing obviously that is wrong with the ears. So I'm going to palpate your pinna. Do you feel any tenderness?
No.
And with your tragus, any tenderness?
No.
And then again with the pinna, any tenderness?
No.
And the tragus, any tenderness?
No.
Good. So those are all normal findings. There's no tenderness with palpation. So then I'm going to take a look into your ear. I'm going to pull up and back. The tympanic membrane is pearly gray. It is intact. There's no discharge, no abnormalities. The cone of light is present at 5 o'clock. And then I'm going to do the same on the other side. Up and back. And again, tympanic membrane is pearly gray. It's intact. There's no discharge, no abnormalities, and the cone of light is present at 7 o'clock, which are all normal findings. Next, I'm going to test her hearing acuity. So I'm going to strike this against the counter, and I'm going to put it at the top of your head. Just let me know if you could hear the sound equally in both of your ears.
Yes.
Okay, perfect. And then we're going to do, that was the Weber test. We're then going to do the Renee test. I'm going to put it on the back of your ear. You're going to tell me when you stop hearing it, and then in front of your ear, you're going to tell me when you stop hearing it.
Okay. Okay.
Perfect. And then same on the other side.
Okay. Done.
Okay, and what that tests for is we want air conduction to be greater than bone conduction, which it was bilaterally, which is a normal finding. Next, I'm going to move on to her nose. So with the nose, I'm going to take a look at her general nose. Her nose is in the midline. There's no masses, no lesions that can be seen. There's no obvious deformities. Can you just press on one nostril and inhale? And then do the same with the other side. And any problems?
No.
Okay, so her nose is patent. I'm then going to take my otoscope again, and I'm going to inspect the nasal mucosa. So just look up. Okay, nasal mucosa is pink and moist. There's no discharge. The turbinates are present, which are all normal findings. And then I'm going to do the same on this side. Again, nasal mucosa is moist and pink. There's no masses, no lesions. Turbinates are present. Septum is midline. So those are all normal findings for the nose. I'm then going to test cranial nerve number 1. I'm going to have you close your eyes, close your nose, and tell me what you can smell.
Coffee.
Perfect. So cranial nerve number 1 is intact. The next thing I'm going to do is I'm going to inspect her mouth. So first I'm going to take a look at her general mouth. There's no obvious deformities, no lesions, no masses that can be seen, no abnormalities. I'm going to have you open for me. Okay, the nasal mucosa is moist and pink. The buccal mucosa is moist and pink. There's no lesions. Dental hygiene appears to be intact. I'm going to just lower your tongue. The tonsils are present. They are 1+. There's no redness or erythema. Say ah. Ah. Perfect. And the uvula is in the midline. While I'm in there, I'm going to assess your gag reflex, which is intact. And her gag reflex tests cranial nerves number 9 and 10. So those are both intact. To assess cranial nerve number 12, I asked her to stick out her tongue. So cranial nerve number 12 is also intact. Her hard and soft palates are intact as well. And then the next thing I'm going to do is I'm going to assess cranial nerves number 7 and 9, which is taste. So I'm going to hand you a little snack, and you're going to tell me if it's sour or if it's sweet.
Sour.
Okay, perfect. So cranial nerves number 7 and 9 are intact. Next, we're going to move on to the neck. So for the general inspection of the neck, there's no obvious deformities, no discoloration, no masses, no lesions, nothing abnormal that can be seen, which is a normal finding. I'm going to assess your lymph nodes, okay? So we're going to start with the submental, submandibular, preauricular, posterior auricular, parotid, occipital, posterior cervical, anterior cervical, and supraclavicular. So we want them to be non-palpable, which they were, is a normal finding. And did you feel any tenderness when I palpated those? Which is also a normal finding, so we want them to be non-tender. The next thing I'm going to do is I'm going to palpate her carotid pulses. Okay, and both are present. Then I'm going to come around to the back of you. I'm going to assess your trachea and your thyroid. Okay, so just swallow for me. Trachea is midline, and her thyroid is smooth with no nodules, and there is no goiter that can be felt or seen. So those are normal findings. To assess cranial nerve number 11 then, I'm going to have you turn your head left and right, up and down, and then just shrug against my hands. Perfect. So cranial nerve number 11 is intact. I'm then going to take my stethoscope and I'm going to auscultate her carotid arteries for any bruits, and I'm going to auscultate her thyroid also. Okay, and no bruits were heard, which is a normal finding. Then we're going to move on to the posterior chest. So I'm just going to have you turn a little bit. So normally I would have the patient take their gown or shirt off at this point. My patient feels more comfortable leaving her shirt on, so we're going to leave the shirt on for this exam. But what I would start out with is a general inspection of the posterior chest. So I would make sure that there's no masses, no lesions that can be seen, no abnormalities. And I would have you put your hands, crush your hands in front of your chest and take a deep breath in. Okay, so posterior chest expansion is symmetrical, which is how we want it to be. I'm then going to assess her tactile fremitus. So I'm just going to have you say 99.
99.
One more time.
99.
One more time.
99.
Okay. No, there was no abnormal vibrations that could be felt, so there's no tactile fremitus, which is a normal finding. I'm then going to percuss her posterior chest and auscultate her posterior chest. Okay, and there was no areas of dullness, no abnormalities with percussion, which is a normal finding. And then just take deep breaths for me. Okay, and her lungs are clear and equal to auscultation bilaterally, no wheezes or crackles. Next, we're going to move on to the anterior chest. So I'm going to have you just turn around again. Again, I would take a look at the front. Her shirt normally would be off for this, so I could have a better visual field. So I would take a look at her respiratory rate pattern. She has a regular rate. Her breathing is deep and even, which are all normal findings. Chest is rising and falling symmetrically with each breath. I'm then going to percuss you again, okay? And then I'll auscultate you after. Okay, perfect. And there was no areas of dullness that could be heard, no abnormalities with percussion. And then I'm going to listen. Deep breath. Okay, Perfect. Lungs are clear and equal to auscultation bilaterally in the front as well from the anterior portion, with no wheezes or crackles. The next thing that we're going to do is I'm going to do your cardiac assessment. So for your cardiac assessment, I'm going to have you just lay back. And again, for this, I would also have her normally have her shirt off, but she feels more comfortable having it on, so we're going to leave it on for the purposes of this video. I'm going to auscultate your heart. I'm going to listen with both sides of my stethoscope to the major cardiac landmarks. We're going to start off with the aortic at the second and right intercostal space. Move on to the pulmonic at the second left intercostal space. Resp point, left third intercostal space. Tricuspid, lower left sternal border at the fourth intercostal space. And then move on to the mitral, which is the left fifth intercostal space, medial to the midclavicular line. Again with the bell. Aortic, pulmonic, Resp point, tricuspid, and mitral. And there was no bruise or adventitious sounds heard. There's no murmur. S1 and S2 are both present, which are all normal findings. Next, I'm going to assess your arteries. So for your arteries, I'm going to lift up your shirt. We'll start off with the aorta. So there's no visible pulsations. I'm going to palpate, no thrill, and then I'm going to listen. And no bruise can be heard. So then we're going to do the renal. Again, inspection, there's no abnormalities that can be seen. Palpate, no thrills. And then while I'm doing that, I'm also going to do the iliac, which again, inspect, no abnormalities can be seen. Palpate, no thrills can be felt. And then also the femoral, so no abnormalities can be seen here either. No thrills can be felt. And then I'm going to listen to all three. Okay, and no bruise were heard at the renal, iliac, or femoral arteries. Next, I'm going to assess your pulses. So we're going to start with the popliteal. We want them to be equal and felt bilaterally, which they are 2+ bilaterally and equal. We'll do the posterior tibial next. Equal bilaterally, 2+. Your dorsalis pedis, 2+, nice and strong, equal bilaterally. Then we'll move on to your radial, which are present, 2+, equal bilaterally, and finally your brachial, 2+, present, and equal bilaterally. That concludes my assessment.